Welcome to the Watercooler Forum, the engine room of ideas here at the Menzies Research Centre, the place where we go to think aloud about liberal solutions to the policy challenges we're facing. Tonight, the price of lockdowns. These have been the most extraordinary set of government interventions in the economy, our social lives and private lives since World War II, and arguably before that. We're not here to discuss the public health benefits. Those we will assume are correct, and in any case this train is too far out of the station to change track right now. And the vaccine programme is currently running at the rate of 90 jabs a minute, if my calculations are correct, or about 900,000 this week, which gives us a glimpse of light at the end of the tunnel. But we do need to talk about the cost. Billions of dollars of lost economic activity, businesses on their knees, disrupted educations, and a mountain of government debt. To take stock of the carnage, let's and hopefully point towards some solutions. We've assembled a gathering of wise heads from small business, economics, and education. Wes Lambert is the CEO of the Restaurant and Catering Association, and he's been at the epicentre of an extended small business recession for more than a year now. For a perspective on education, I'm joined by Dallas McInerney, CEO of Catholic Schools New South Wales, and I'm delighted to welcome my former colleague Judith Sloan, an economist and company director, a former commissioner of both the Productivity Commission and the Australian Fair Pay Commission, and a former deputy chairman of the ABC. Judith, let's start by considering whose lives and livelihoods are most disrupted by lockdown and why there are others who are barely affected at all. Your old stumping ground, for instance, the ABC, there's some very pro-lockdown cheer squad people among them, led by the health expert Norman Swan. But I suspect that the lockdown has very little impact on their lives and certainly not on their incomes. At the same time, we've got public servants who make all the decisions about this are in the same position. And yet at the other end of the scale, there are people in manual jobs, people in hospitality and hotel and catering who are really doing it hard.
Look, it is, Nick. The idea that we're all in this together was always a complete nonsense. We're not all in this together. And one way I think of slicing this pie is to think of knowledge workers and public servants. I guess I'll have to call them knowledge workers too by and large. Those who can work from home, they're probably about a third of the workforce. And they've been little affected by this, as a matter of fact. And of course, for many of them, I think they regard this as an enhancement of their well-being by not having to get on crowded trains and buses to go into the CBD. The ones who I think are most harshly affected are small business owners and workers that are required to front up, to actually be near the student, near the customer, near the patient and the like. Those, I think, have often borne a very high cost, and of course, in many cases, a very high financial cost. So it's been an extraordinary situation. If you look at what happened last year, Australia hadn't had a recession, so 2 successive quarters of negative growth for well over 20 years, and then we did. Because the effect of the lockdown, which, can I just point out, it's a really important point in terms of thinking about the economics of this. This was a supply shock, right? It wasn't because people weren't capable of spending money, but they were basically not allowed to spend money. And the government reacted with that supply shock, with the lockdown and the restrictions and the border closures, by pumping in some $300 billion, just the federal government, to try and compensate. But it's kind of a very interesting analysis from an economics point of view, that it's not like the GFC. This is something different. This is where economic activity was basically precluded, was prohibited, and therefore the way you get out of it, or the way you don't do it, is very, very important.
Well, Wes Lambert, I'm sitting here in the heart of the Sydney CBD. I've taken the view that public policy discussion is essential business, because if it's not, then we're in more trouble than I thought. And as I walked in this afternoon, I saw what you must live every day. Closed restaurants, shuttered coffee shops, one or two just trying to stay open, people standing there with masks on behind the counter with a tray of unsold sandwiches. This is a real tragedy for small business, and unless you come here to the heart of the CBD, I don't think you get an impression of exactly how bad it is.
Like you, I'm also in the office today because lobbyists and industry associations are seen as essential, because we're fighting for the industry and fighting for hospitality businesses. As you said, the CBD in Sydney is a ghost town and has been through lockdowns in 2020 and 2021. And also, even when the lockdowns are not in place, the CBD has been dramatically affected by many people working from home 2 or 3 days a week, and a severe drop in consumer confidence, which was confirmed today. That consumer confidence is at all-time lows, and many people are just not going to the CBDs to enjoy those sandwiches and coffee and takeaway. In New South Wales wider, we're seeing revenue drop as much as 40% outside of Greater Sydney due to the lack of business confidence and the lack of people coming in. And many members and industry participants do report to us that because the lockdown was initially only supposed to be 2 weeks, a very short amount of time, they didn't necessarily pivot their businesses as they would have if they expected a extended lockdown like 3 or 4 months. And so they've been caught short trying to scramble to restart their takeaway and delivery and try to get some of that lost revenue back, as we do expect that the lockdowns could extend to the end of August.
Dallas McInerney from Catholic Schools New South Wales. 2020 was almost a write-off for some school students. Those in year 12 preparing for their school certificates were doing it very tough. But so were kids at the other end in reception classes. It was my grandson's first year in school, and the interruption of COVID lockdowns made even harder for him what I think is always a traumatic experience for 5-year-olds with their first experience of school. What is the picture like this time around from the chalk face?
Thanks, Nick. There was an automatic assumption when the government moved to pull this harshest of levers, and we can argue the justification of that or otherwise, that when schools were closed, or technically not closed, but only available to those kids that really needed to come, that everything could be flipped back into the home. And whilst the sector on the whole demonstrated enormous resilience and in some instances a degree of agility, which surprised even itself, that can we build these online learning platforms, can we go digital, and can programs and lessons be written at short notice to cater for this very dislocative and disruptive change to the delivery of schooling. And I think coming out of 2020, there was a little bit of too much coming outside the sector of congratulations that this is fantastic, well done, and schools really stepped up. But if you go deep into it a little further, I don't think it was the best experience for teachers, students, or families. That can you flip your family home, into a learning centre overnight? If you're both working from home, how do you homeschool? And then for those kids who are perhaps in primary school and infants, can you really homeschool those kids effectively? The higher up you get in the age scales, they're more self-directed, they're working off programs, and they're almost along the way. But how do you homeschool a kindergarten or a year one? And there is no substitute for being in situ with your learner. And for those kids, and we know the pedagogical pendulum has swung in a policy sense, that if we know that direct instruction is the most effective means of delivering schooling and scholarship, when you cannot do that via Zoom, and or not effectively anyway. So the headline commentary around, homeschooling, away you go, and it'll be okay. I think that the jury is still out on that. The long-term research on what learning regressions took place for our children, the lost opportunities for being outside their schools, but it's beyond the learning as well. It's a social connectivity which comes from a school setting, both in the professional sense of the teachers that interact and as professional learning community, but then the non-academic learning and development which takes place inside the school gate. So I really think we have to think long and hard, and we shouldn't be, there's a risk that people are overly enamored or even bewitched by the marvel of homeschooling or digital learning. And I think it would be a real pity if we got to the end of this, and hopefully we will, that if there are people who want to persist with this more than we should, lest our schools become these ghost towns and soulless existences which our university campuses become. That there is no on-campus esprit de corps at our universities, and there's a bunch of reasons for that, and we should be very mindful that's not to be the fate of our schools.
To pick up on some of those points, Judith, this idea that children just absorb knowledge by immersion, that teachers are just enablers of discovery rather than instructors, has done a lot of damage in education in the last 20 years or so. This, of course, was one of the issues at the heart of the discussion over the proposed national curriculum. If, as Dallas says, the lockdown is giving some teachers license to double down on this failed approach, we're doing our children a grave disservice, aren't we?
Well, my guess is in like 15 years' time or so, the Labor economists will be putting 2020 and 2021 in as dummy variables to see whether they can pick up any impact on people's long-run educational attainments and indeed career attainments. But again, I think it's a really clear example of we're not in this together, in the sense that I think probably the wealthier families, the families with slightly bigger houses and the like, are often better placed to switch over to homeschooling. There's a lot of assumptions, I think, for people, as Dallas said, where both parents are trying to work from home. I mean, I have a daughter who has 4 children. It's basically impossible. And her twins, started school last year. And as Dallas said, they couldn't read, right? So, homeschooling really didn't make a lot of, and then she had the 4-year-old in the background having this back attack. So, no, I think the broader point is this, Nick, and I really think the Menzies Research Centre has to be brave on this, is that to what extent was all this stuff evidence-based, shutting down the schools? Where was the evidence at that point? Were the students a vector of the disease? Were the teachers a vector of the disease? Should we have tried to get teachers vaccinated early so we could keep the schools going? I think people will look back on these years and think, gosh, and I know Wes has got some issues about rushed public policy, but surely this is another one, that there was just an assumption, we'll switch over to homeschooling and remote learning as if this was really a substitute for what had previously occurred, and whether this really made the slightest bit of difference in terms of the progression of the disease.
Whereas in the window between lockdowns, we had a chance at the Menzies Research Centre to travel a little bit. We were in Perth with Tony Abbott, and I travelled to Melbourne a couple of times, and of course to Canberra, where I'm destined to spend the parliamentary sitting weeks. In all those places, I think, with the exception probably of Canberra, I noticed coffee shops I'd used before that were closed, restaurants with their doors shut, and just a general lack of life. The first wave of lockdowns, it seemed to me, took a huge toll. With these new lockdowns, we're looking at a second wave of business failures, aren't we?
So in the first 3 months of the lockdown, which ended at 30 June 2020, the ABS didn't see a lot of closures, and that was mainly due to the fact that there was so much shock from COVID, and there was so much stimulus in the beginning. As stimulus began to wane, as businesses achieved that over 30% down in revenue, and they were no longer eligible for JobKeeper. And then 31 December came around, and the landlord protections ended, and the insolvency protections ended. And then 28 March hit, and there was no more JobKeeper. There were many businesses that just weren't stable enough during COVID, the first lockdown, in order to continue operating. In almost every CBD and many suburbs, you will see landlord in possession signs and for lease signs. Ultimately, the ABS will be telling us in December of this year the net entry and exit in accommodation food service. We do expect that it will fall in somewhere between 10 and or 5 and 10% drop in the total number of ABNs in accommodation food service, and that's certainly less than it could have been. Most of those would have closed in the second half of fiscal 21. Certainly, we do expect that, given the sawtooth up and down lockdowns that we're now experiencing due to the Delta variant. I remember just weeks ago, National Cabinet said that lockdowns would be a last resort for COVID, and then it has become the first resort. And it is the correct health response. We have seen in New South Wales that letting a short lockdown go too long can lead to extreme Delta cases in the community. However, they must be followed on with stimulus immediately, and they must be ended as soon as that community transmission is in train.
Well, the good news is we've got a lot of data on the pattern of COVID that we didn't have in the first lockdowns. We know who's at risk of dying of COVID. We know, Dallas, that children are not at risk unless they have they're in a very small special category of children with serious pre-existing illnesses. The likelihood of a healthy teacher of working age dying is negligible. The likelihood of an Australian under 50 dying is probably statistically insignificant. What can you do to convince the government that it is safe to reopen and that you've got the right protocols in place to prevent, say, parent-to-parent contact or parent-to-teacher contact, and that whatever small risks there are, you can manage it?
I think Judith hit on it earlier, and that is the vaccination program. And I think the prioritisation of teachers in the vaccination program needs to be looked at very quickly, because there is a cross-protection which comes to the unvaccinated. And if the children are still unable to get the vaccines, because all 3 vaccines in Australia, none of them have a licence to go to children under 16 years of age. So what you do as a workaround solution, you vaccinate those closest to them, and that's in the school setting, the teachers. So you get this, what the virologists call this cross-protection phenomena happening there. And anything you do to bolster the safety of the school setting inside the gate, the quicker we can get the kids back. And this was an impulse we had last year in 2020. And interestingly, it was the government who was urging us to get these schools open quicker and not persist with restrictions on in-school learning, because they absolutely understood that connection between the school cycle, enabling the workforce in an industrial economy to get back, and the important, that interconnectedness. So I think that's got to be looked at really quickly. But I think more broadly, when we look at, and this is something which the Menzies Research Institute's got a good track record on, and maybe this is a generation of our leaders who have forgotten to read the classics. And if they were to go back and read everything around social contract theory, start with John Locke, everybody, Rousseau, and say, well, to what extent is as we as citizens, or we acting on behalf of the citizens, are willing to give up their natural rights and freedoms, innate as they are, in return for whatever protections and order a political intervention or officialdom can deliver. And if the balance is right, you'll get the citizenry. And that's the contract, both parties to the contract win on that. And I think that's a threshold question for our times now. Are both parties delivering on their part of the social contract? It's an arguable question for me.
Judith, you might recall at the start of the pandemic, Menzies Research Centre assembled a highly credentialed team of economists to do some modelling to try and figure out how to deal with COVID-19 without killing the economy. Look, it was a bit of a shot in the dark, to be honest. The economy is much more complex than you imagine when you try and analyse it bit by bit. But what we did do is we arrived at a scenario where we tested three situations. So you could lock down hard, you could not lock down but introduce other social distancing measures, or you could stop-start. So you could turn on the lockdowns when there was a wave and switch it off when the number of infections disappeared. And of course, what we found was that the worst case of all was the stop-start approach. And yet that's pretty much what we've ended up with.
Not that I'm necessarily a big fan of Maynard Keynes, but he was absolutely right about stressing the importance of what he called animal spirits in terms of driving the economy. And what the sort of, it's not just the stop-start nature of the lockdowns, it's the sort of unpredictability of it too. So, I mean, there was a point earlier this year when the Australian economy was looking quite good. We'd had a V-shaped pattern of economic activity where it had gone down, but it had bounced back. And so we, got some good GDP figures in the December quarter and the March quarter, for example. And the most recent unemployment figures were below 5%, in part because we've had the international borders closed all this time. So the growth of the labour force is actually highly restricted. But I just think going forward that you look at the impact, and I think, Wes will need to come in on here. I mean, businesses need to plan, they need to anticipate, they need to think what they're, in a restaurant, how many covers they're going to be getting and the like. And how can you do that in the context of, not knowing whether you'll even be able to open? Now, I guess the politicians will say that, we're dealing with a slightly different beast here with the Delta variant. But, and I have written about this. The trouble with the public health experts, and I use that term, I guess, warily, is that they don't see the world in a cost-benefit frame. They see, okay, here's this nasty disease. What can we do to stop the spread of this nasty disease? They don't see the issue in a much broader framework. And that, I think, has been actually, people talk about the preeminence of the premiers. That's right. But in a sense, it's the preeminence of the public health officials that actually almost worries me more than the preeminence of the premiers. If the premiers had been kind of saying, well, thanks for your advice, now we're going to sort of distill it and come up with some balanced response, that would have been better. But certainly I think, when I see Dan Andrews sort of handballing it over to Bretty, we call him Bretty down here, Brett Sutton, that really worries me a great deal.
So, Wes, we run a small business here, albeit a not-for-profit small business. I know the revenue challenges. I know that we need to keep a cash buffer just in case something unexpected comes along like a pandemic. But the reality for most small businesses is they don't have a lot of cash to put away. And they need regular flow of customers to pay the bills. What's the reality for the restaurant and catering sector? Where do they stand at this point?
Well, ultimately, the restaurants, cafes, and caterers can be considered the most vulnerable of accommodation food service, and that is mainly due to their business model being lease-driven. You will rarely find a restaurant or cafe or caterer who owns their premise. Now, every pub is owned, and every club is owned. There will be a few exceptions, but most of those, and every hotel is owned by the bank, but it's still owned, an accommodation hotel. Whereas restaurants will invest hundreds of thousands to millions of dollars into the fit out of their business. And due to the prevalent rules in the Retail Leases Act in almost every state, the landlord owns that the moment that it's affixed to the wall. And so hospitality businesses normally do not have a balance sheet to fall back on. They typically operate from week to week or from month to month. And certainly, as is reported by IBIS World and the ATO and ABS, restaurant profit margin has decreased to between 3% and 5% on average. And this is mainly due to the relenting increase of underlying costs like wages, the minimum wage, with this latest increase that takes effect in November for our industry, means that wages are up 40% since the Fair Work Act and the Restaurant Award were created. Rents go up 3.5% to 5% a year relentlessly, which in the past decade means that they're up as high as 60%. Utilities and all the underlying fixed costs of the businesses and the cost of food and beverage go up. However, the price of a cup of coffee around the country has been about $4 for a decade. The price of a steak has been about $28 for a decade. Now, many businesses through COVID realized that this was unsustainable. They had run out of cash reserves. They didn't have a balance sheet necessarily to draw from. They had the reputation and the good name of their business and potentially some lease extensions. Many restaurants or businesses that rely on leases value their business based upon the brand name and the years left on their lease. And so almost all of our members, small to medium members, have told us that they have had some cash flow problem in the past 15 months since COVID started, and certainly have not always had the cash flow sources that some businesses with underlying property or fixed assets have. And this has certainly been quite difficult for the hospitality industry, especially during this surprising lockdown.
And Wes, if I just stay with you for a second, the human cost behind that. I mean, you know, we can talk about a business, you know, almost as an abstract, but what's happening to the lives of people? I mean, how is this impacting, in your experience, on small business owners?
Oh, look, the mental health is a number one priority at the moment for our messaging out to the hospitality industry because many people have become despondent and desperate. And it's because they don't see a light at the end of the tunnel. We are promised by multiple governments around the country that we won't, you know, this is the last lockdown, or we'll be out of this lockdown soon, or this particular industry is going to be open by this date. We should learn from the past. You cannot make promises to your business community and to the citizens of your state that you can't fulfill because you can't control how many community transmissions are going to be out there. But on the flip side, you can make a roadmap. And by making a roadmap to get out of COVID, so saying, when we get to this point of vaccinations and this point of community, we'll do this, we promise. Because ultimately, who's going to make a restaurant booking for next weekend, for the 1st of August in New South Wales? Raise your hand. No one. Who's going to book a wedding or a birthday or a business event or a flight in the first few weeks of August? No one. Why? Because no one believes the government that we're actually going to get out of lockdown. And so it's that certainty, it's that being honest with the business community and consumers that, you know, that we certainly have that those levers to pull, and we're going to pull them. Because what happens is you lose the connection between employers and employees. So you have the mental health of the employers that's affected, but you also have the mental health of the employees, because, you know, a $500 or $600 disaster relief payment is nowhere near what hospitality professionals were making, especially during the severe workforce shortage that the hospitality industry is experiencing at the moment because of the closed international borders. So, you know, it's a double-edged sword. You have employees that are looking to their employers for, you know, that assurance that the business is going to be okay, that my job's going to be okay. And they're just not able to provide that because businesses are just not getting that surety from the government.
Dallas, for you in the education sector, would it help to have more certainty? The Premier of New South Wales has floated an 80% vaccination rate before we can relax restrictions. Well, I don't think there's a country in the world that's achieved that. But would it help in running schools to have more clarity of what we're exactly aiming for, what the threshold is for business as usual?
I think so. Humanity always responds well to hope, and that's what we need to have more of. But we should acknowledge at the moment, more than business as usual, every decision inside government is a hard one. And in this instance, in this point of history, they are literally life and death decisions which the government and our leaders are making. So we should acknowledge that. But if we give some endpoints or a roadmap or a pathway out, that by definition is a form of hope. And then people can start orientating themselves to a future or a better life. And they may take their medicine a little more readily than they are at the moment. So I think, a vaccination target, I think everybody's watching very closely with what Prime Minister Johnson's doing in the UK. I think it's the biggest roll of the dice of his career with Freedom Day. He is betting pretty much everything, the whole house, that he's got a vaccination rate of his population which sufficiently breaks the link between infection and hospitalisation and serious illness. If it's something mild the population can live with, he's away and the whole world will follow suit. But he's not at 80% for his population. It's still around the 60s the last time I had a look at it, notwithstanding England invented AstraZeneca. So I think that, as I said, populations, peoples, history, when hope's put in front of them, they're orientated towards that. And I think particularly the discourse we're seeing at the moment, I think we need more hope. And those 11 a.m. press conferences in New South Wales, they're important information sessions, but there's not much hope in them.
What about some specific targets, Dallas? If we were to say, for instance, 80% of the over 70s, perhaps 80% of those who care for them, and a high rate for teachers and others in the frontline roles like that, rather than a measure that asks for everybody over 16, regardless of the risk, to have the jab. Surely that might be more achievable.
Yeah, I think there's a target, and then you can work back from it. Then you can put plans around it. And then, all sectors, education otherwise, can start planning for it. Like these other sectors, schools and big systems of schools, they're big operations. They don't turn on a dime. Here in New South Wales, this lockdown, compared to last year, has come at a time much closer to the HSC delivery. So we're, turning our minds to how we can maintain the integrity of this end of school leaving credential, if you like. And when it's hostage to infection figures coming out 11 o'clock every morning, that's totally antithetical as to how you might plan for people's educational futures. But it is where we are. That's not a criticism, it's an observation. But if we were to have a target, it always sharpens the focus and makes people accountable. And then we could track it, then we can measure it. Because if you can't measure it, you can't improve it. So I think some more certainty around that, Nick, is probably a good idea.
Judith, staying with the future of school children who will eventually grow up and go out into the big wide world and hopefully become taxpayers, they're facing a mountain of debt. The Intergenerational Report 2021, which Treasury released last month, probably got a fair bit less coverage than it deserved, probably because of our focus on the pandemic. But the projections for national debt made very gloomy reading. In the first decade of this century, as you recall, we were debt-free. Now we face a debt riding above 40% of GDP by the middle of this decade, staying in the 30 to 40% band for the next 40 years, 2061, which is about as far as Treasury is prepared to forecast. What do you make of that?
Oh, and really, in many ways, it was almost a best case scenario what they were forecasting, because they were bunging in productivity growth figures, at 1.5% per year, which are extraordinarily optimistic. And if you look at what really drives the economy, it's productivity. So it could well be a lot worse than that. But even under that scenario, for the sort of next 40 years, we run budget deficits every year, and build up government debt every year, therefore. Look, I think, I just wonder whether there was and I hear that, there are a lot of people badly affected, there are a lot of businesses badly affected, but there was also, I think, quite a lot of what we call dead weight loss in what happened last year. They implemented Job Keeper very, very quickly. And there were a lot of businesses who did really quite well out of that. And that was not the intention. But I think the effect of governments basically operating as if there's no budget constraint is, I think, extremely problematic, because what happens is that they're not creating any trade-offs. They're not saying this is very worthy spending and this is not worthy spending and we're not going to do that. If you don't have any budget constraint, you basically reduce the quality of the spending dramatically. And I think you saw that happen. And really the states now also have behaved in a way where they don't have a budget constraint, where in the past, they were worried about losing their credit ratings. No one's worried about losing their credit ratings now. And so, again, I think that there's a very undisciplined attitude to government spending. And that ultimately affects, what I'd call economic freedom, because you're getting ultimately a future tax burden out of that, but also you're getting governments involved in areas that they shouldn't be involved too. So I think it's been really, from an economics point of view, a sort of development which is very unfortunate. And who knows, as you say, what the longer run consequences are. We've been able to pump up the economy. I mean, there's no doubt about it. And it's interesting, if you look at the savings ratio, it sort of suggests that we overcompensated people, because the savings ratio went way up because people couldn't spend, but people kind of became fearful and they saved, but we now have to sort of pay the price in the coming years. Just quickly on that point about targets and the like, I thought it was very unfortunate that the Commonwealth government, who I think has been outwitted by the states in all of this, by the way, they look very weak and the National Cabinet's been a joke, to say that, we're going to subcontract the decision about vaccination take-up to the Doherty Institute. Again, I think it's a political decision. And also, my guess is that the states also will have a particular view, because I think Dan Andrews and Gladys Berejiklian have both been sort of floating particular figures. So I'd like to think there's a roadmap out, but it looks still pretty messy.
Well, let's talk a bit more about spending, Judith. At the Menzies Research Centre, we were happy to cut the government a bit of slack over the emergency spending last year, which was necessary and seemed to be well targeted, or as well as it could have been under such difficult circumstances. At least when it came to the crunch, they ended the job seeker supplement on schedule, albeit with a modest increase in the base level.
New Zealand got rid of their JobKeeper in September. We kept ours going till March, so I agree with you initially, but I do think, we've got a chicken and egg problem, right? I think, the states continue to impose these lockdowns and border restrictions in the knowledge that the federal government will come good with this funding, right? Yeah. And wherever there's that disjunction, I think you get some sort of serious policy flaws.
Yeah, well, here I think you've hit on the heart of the problem, haven't you? The federal government raises the money and the states have much less motivation to keep spending in check. It's a fundamental flaw in our federation. The Commonwealth, just like an ATM. In New South Wales, I've seen estimates, for instance, that the lockdown is costing us, $1 billion a week, which I think is probably pretty conservative. Yet, if we assume that that's true, it means that 2 weeks of lockdown, they will burn enough money to build a new 500-bed hospital like the new one on the northern beaches. When you're talking about debt, it's the type of spending that matters as much as anything, isn't it?
Nick, can I come in on that? I think what was unique about New South Wales heading into this second phase of COVID for Australia was Dominic Perrottet was the only treasurer in the Commonwealth who was prosecuting a productivity agenda. And he was doing it across a number of domains. Firstly, he set up a state-based productivity commission and gave it free rein to go through all the sectors, including government itself. And what was emerging from the Perrottet agenda before we went to the second lockdown was a clear blueprint for a 21st century New South Wales, going to education, mining, government and service delivery, you name it, and without much encouragement from the feds, really revisiting the issue of Commonwealth-state relations. So to the extent there was a flaw, intellectual ballast, a policy flaw, if you like, underneath New South Wales going in, which wasn't evident with the other states. So that stands in good stead. Now, the challenge would be, does the New South Wales government have the courage to pick that up and use it as a basis to emerge from this stronger, better, and more prosperous? Or, I think that's a big question for the New South Wales government.
Wes, do you feel that the fate of small business has been somewhat overshadowed? I mean, the policymakers have been distracted by the surprising strength in the economy as a whole, in which some small and medium businesses have done really well. I mean, the company Road, for instance, make these things. Australian company, great product. They've been doing very well because people have been organising webinars and things like this and all sorts of things. But at the other end of the scale, I mean, for small business and particularly for the restaurant and catering section, it's been a very dark picture.
Well, I will say that through the efforts of restaurant and catering, that we certainly have earned our place at the table over the past 15 months, and certainly do have the ear of the leaders of the states and the Commonwealth in shaping legislation. We're certainly working with New South Wales Treasury as well as federal Treasury on these stimulus packages that are being rolled out in the coming days and weeks. And certainly, we do feel that accommodation, food service, arts and entertainment, and transport as a part of transport, warehousing, and postal, which is basically tourism, have certainly disproportionately felt the brunt of the restrictions and lockdown. In fact, whenever you look at restrictions that come out of each state and territory, whenever there is a lockdown, they're almost all focused on suppressing hospitality, suppressing weddings, funerals, dancing, singing, events. They're not talking about the tire store opening or not opening. They're not, and not to disparage the tire industry, but they're not talking about lots and lots. The ASX has traded every day since the lockdown started, except for the day that their software went down. And most industries have been able to trade through COVID, even those that received very large JobKeeper payments. So, ultimately, because of the nature of COVID, we are the hardest hit. And it does take certainly a lot of discussion and a lot of pushing and certainly a lot of reminding, as you said, during that January to let's call it, we'll go ahead and call it June around the country, where we'd seen a return to pre-COVID levels, to revenue levels even higher than 2019 in accommodation food service in our particular sector. But we certainly have to be running towards the front of the line whenever restrictions or lockdowns are announced to ensure that everyone remembers, hey, you love going to your local coffee shop, takeaway, cafe during the lockdown. That's your mental health. That is what you do. That's what you're allowed to go out to do throughout the day. If those businesses don't survive, it's going to be pretty grim during lockdown periods for you to just be able to, exercise and go to the grocery store. And so we will always try to stay at the forefront in every state and territory and with the Commonwealth to ensure that they remember that we will be the hardest hit sector every time the lockdown is extended.
Okay, some quick final thoughts. Dallas, you go first.
Look, I think it was inside the Obama administration, which I'm not a huge fan of, that the term was coined, the phrase, never waste a crisis. And clearly this is the biggest crisis we've had since the Second World War. And every instrument of public policy has been orientated to support us through the pandemic. And we've had, under some spectre of illness, the population has been able to be galvanised and be made quite compliant in some of its responses and behaviours. Can we put all that accent on the positive when we climb out of this and head past the pandemic? To similarly is the leadership in the country for us to galvanise the whole population like we have, not out of a negative fear as we are at the moment, and rational as that is, but for the future and for a better, more optimistic Australia. And there's some big decisions ahead of us, and Judith has spoken to some of those. I think that's going to be the challenge for our leaders on the other side of this.
Judith?
Look, I think that's a very good point by Dallas. But I think in the short term, the real issue is how do we roll out the vaccination program more rapidly, and focusing, as you say, Nick, on the most vulnerable. We don't really have a clear view as the proportion who are, quite legitimately vaccine hesitant. I think that's an issue point. But an issue that's also coming up, and I guess you all have been reading what's happening, for example, in Israel, that it's not clear that the vaccinations are actually quite as effective as everyone had hoped they would be, and particularly against the Delta variant. So, I'd like to think we're kind of, we can see the light at the end of the tunnel, to use a perhaps inappropriate phrase for the Menzies Research Centre. But, I think it's still messy days ahead, to be truthful, and we won't know really till towards the end of the year where we're really heading.
Finally, Wes from the Restaurant and Caterers Association, how do you see it?
I certainly agree with Dallas and Judith that there's a lot of uncertainty ahead. We need to learn to live with COVID. That is the key message. Many countries that have medium to high vaccination rates are starting to count how many people are in hospital, how many people are in ICU, how many people have passed away. So they're no longer counting cases per day, because if you want to live with COVID, there are going to be cases in the community. It's just a natural part of being human and being on this planet. There are lots of pathogens around the world, the flu pathogens and rhinovirus, and lots of pathogens that float around, and we've learned to live with them throughout history. And so it will be important, as the fear begins to subside, as the vaccine rollout continues, that there are leaders around the country that are willing to listen to businesses, listen to the population, and accept that we will have to learn to live with COVID, or we will become a hermit state on an island in the South Pacific.
Well, I think one thing that must keep going, lockdown or no lockdown, is good, intelligent discussion on policy matters. We've done our best to do that today. The Menzies Research Centre, obviously our events program is on hold. We can't go anywhere. We can't even do anything in Sydney anymore. So we're on hold yet again indefinitely. But in the meantime, we're going to do more of these video and audio productions for you, which we really ramped up last year. We want to ramp up to a new level this year. And this is where you can help us. You can help us by subscribing from just $10 a month to the Menzies Research Centre. That support will help give us the financial support we need to get through this time, and to make some more investment in the equipment you see around you, which is forever necessary. You can also donate to the Menzies Research Centre, of course, with a tax-free donation. You can find all that on our website, www.menziesrc.org. It just remains for me now to thank our panel. Thank you, Judith Sloan. Thank you, Dallas McInerney and Wes Lambert. Thank you for joining us, and thank you for making this such a productive discussion.
Thank you, Nick.
Thank you.